Wouldn't it be just great to know that you've got someone looking out for your best interests when you're faced with a health crisis? In this edition of Health Matters, Dr. David tells us about some caring advocates that are ready, willing, and able to help you in your time of need.
Let's face it, navigating America's modern healthcare system can be difficult. So how can patients and their families feel empowered to make informed decisions about their own health? The answer is with the help of a case manager.
Most patients don't know what that word empowered means. In fact, I think they feel pretty hopeless.
That's Sherry Latimer, the Executive Director of the Case Management Society of America. She and her fellow case managers are patient advocates who understand the ins and outs of the system. They provide critical information when clear thinking is needed the most.
I find that patients really do want to be in control of their life, of what happens in their health care, and yet don't really have the tools and resources to be able to do that.
Debbie White knows exactly what she means. A few years ago, her husband's parents, Ed and Ethel White, were hospitalized the very same day for different problems. Each faced an uncertain future. Debbie and the family were almost paralyzed by the decisions facing them. That is until the hospital provided a case manager.
I wasn't even aware of what a case manager did at that point. None of us were. So she was a godsend.
The case manager showed up with the resources available to her aging in-laws. She understood the medications they were taking, the costs involved, and the options that could be pursued after transitioning out of the hospital. Most importantly, the family now knew what questions to ask their doctor.
She did not make this decision for us. She just said, these are your options.
Most hospitals now have case managers on staff. Many are nurses, some are social workers. Because they work jointly with doctors and patients, the quality of care is improved and sometimes the costs are lowered. If you or someone you love is in need, you shouldn't hesitate to ask for a case manager if one isn't provided.
She was just an essential partner with us.
In the end, Debbie was so moved by the help she'd received. She changed her career. She now works with case managers to ensure that others enjoy the same peace of mind her family did. Because there's comfort in knowing you've made the best choices available, and comforting to know a case manager will be right by your side to help you.
And they've got to be very special people, too.
Well, I think there's no question that one of the big challenges we face is dealing with someone in the hospital with an acute illness. And at almost every day, I'll get a frantic call from one of my patients whose loved one is in the hospital, and I give everybody my cell phone number. And usually it's because someone has decided to discharge the patient and nobody knows what to do. Where can they go? Should they go to a nursing home, recuperative care? What resources are available in the community? A case manager is an invaluable asset because they help put it all together.
And when it comes to the health of that person, it's got to be such a benefit too, because if someone's sick and they're trying to recover from whether it be a surgery or they're getting a certain stage in their life, you know, for them to be worrying about all these other things,
absolutely,
it's going to inhibit them from getting better.
Usually it's you who's worried because it's your parent who's in the hospital.
Yeah.
Anybody who's dependent needs a case manager, but the vast majority of dependent people who are coming out of hospital are older or very old. So usually it's a child or a spouse who says, what am I going to do? It's incredible to me how frequently I hear someone tell me, they want me to go home and they still have a catheter in my dad. It's ridiculous.
So this, because there are so many questions, and that's
Absolutely.
the thing too. I think a lot of people might be a little intimidated when they're in a hospital setting, and they feel that maybe I shouldn't ask that question because it'll make me look stupid, or I might, you know, the doctor or the hospital might think that I'm confronting them on an issue. You should always ask these questions.
Absolutely,
right?
But ask for a case manager.
This is a great way to have someone on your side.
An advocate for you.
What if a case manager isn't available?
Well, you know, you can actually hire a case manager, but there is advantage of being in the business that I'm in. I'm a geriatrician, and this is what I do every day. So my patients are fortunate in that when there is a problem like this, I will turn to them and tell them who they need to go. And believe it or not, the American Society for Case Managers is located right here in Little Rock.
Perfect. So one of the most important questions to ask, do you have a case manager?
Absolutely.
If so, get in contact with that person.
Definitely.
All right. Dr. David, thanks very much. Have a happy
Thank
Easter.
you, Bob. You too.
Excellent. Always
Enjoy
a pleasure to
that
see you.
Easter egg hunt.
We are.
I have had so many Easter egg hunts, and fortunately the best ones are when it's raining like crazy, and then I don't go outside.
We'll invite you over. You can find the ones we can't find. Melissa?
All right, guys.